Benign prostate hypertrophy. Prostate have 5 lobes, one anterior, one median, one posterior, and 2 lateral lobes. And this is venomontanum of the prostate, which is situated in the posterior wall of the urethra. Next, benign prostate hypertrophy is also called as fibroadenoma of prostate. It is benign enlargement of prostate which occurs after 50 years, usually between 60 to 70 years. It affects both glandular epithelium and connective tissue stroma. Etiology: it occurs mainly due to disturbance in the ratio and quantity of circulating androgens and estrogen. Hypothalamus pulsatile release of luteinizing hormone. Releasing hormone stimulates anterior pituitary, which results in release of luteinizing hormone and stimulates Leydig cells of testis and release of testosterone. This testosterone stimulates prostate and release of 5-alpha reductase type 2. This 5-alpha reductase type 2 converts testosterone to dihydroxytestosterone, which is 5 times more potent than the testosterone. Increase in the age after 50 there is a drop in testosterone level but fall in estrogen level not equal. So prostate enlarges through intermediate peptide growth factor. Pathology: most common lobes involved are lateral lobe and median lobe. Median lobe enlarges into the bladder and lateral lobe narrow the urethra, causing obstruction. Narrow this prostatic urethra and causes obstruction. Urethra above the venomontanum gets elongated and narrowed. An enlarged prostate compresses the prostatic venous plexus, causing congestion of the condition called as vesical piles, leading to hematuria. Decoy prostate: it is an incremation. We have to first eliminate BPH in case of hematuria. This is called as decoy prostate. Kidney and urethral back pressure causes hydroureter and hydronephrosis. Secondary ascending infections can occur due to acute and chronic pyelonephritis. Severe obstruction lead to obstructive nephropathy with renal failure, and benign prostate hypertrophy may cause impotence. Clinical features. Clinical features are: there is increase in frequency due to introversion of urethral mucosa into the bladder due to cystitis and urethritis. Introversion of the mucosa into the bladder due to cystitis and urethritis due to repeated stimulation. There is increased frequency. Urgency, hesitation, nocturia, overflow and terminal dribbling, difficulty to maturate, suprapubic pain in the leon and due to cystitis and urethritis. Acute retention of urine, chronic retention of urine, and there is impaired bladder emptying with its problem like cystitis, urethritis, stone formation and residual formation. These three result in fever, chills and burning maturation. There is hematuria, renal failure and prostatism. Prostatism are including of these symptoms. There is frequency of urine is same day and night. Poor stream, there is poor stream and delay in starting and difficulty in maturation. There is delay in starting and there is difficulty in maturation. Examination: there is tenderness in the suprapubic region, palpable enlarged bladder due to chronic retention. Per rectal examination show enlarged prostate. PR is done on an empty bladder. Investigation: urine for microscopy, culture and sensitivity, blood urea and serum creatinine, ultrasound abdomen and urodynamics. In urodynamics, we have to measure urine flow rate and voiding pressure. Urine flow rate is if greater than 15 ml per second, it is normal. 10 to 15 ml, it is equivocal. Less than 10 ml, it is low. And voiding pressure less than 60 centimeters in water is normal. 60 to 80 centimeters is equivocal and greater than 80 centimeters is high. Cystoscopy, transrectal ultrasound abdomen, ultrasonography, acid phosphatase, prostatic specific antigen, IVU and serum electrolytes is done. Management is done in 3 stages. It is acute retention, surgeries and drugs. In case of acute retention, urethral catheterization is done. Urethral catheterization is also done in uremia, and suprapubic cystostomy is done, and correction of serum electrolyte balance. Surgeries are transurethral resection of prostate, Frey's suprapubic transvesical prostatectomy, Millen's retropubic prostatectomy, Young's perineal prostatectomy, microwave therapy with temperature of 45 to 50 degrees centigrade, laser treatment using holmium laser, high energy electromagnetic treatment, placement of intraurethral stent, transurethral balloon dilation of prostate and suprapubic focal cystostomy is done. Drugs used are alpha 1 adrenergic blocking agents which inhibit the contraction of smooth muscles of the prostate. 5 alpha reductase inhibitor inhibit the conversion of testosterone to dihydroxytestosterone. Thank you.